Good morning, Chris Ohl, Wake Forest Baptist Health, Infectious Diseases. Here in Winston-Salem, bright, crisp winter morning. Getting ready for some snow. We'll talk about that in a little bit. So where are we sitting here with COVID? Well, I mean, it's a lot of Groundhog Day, more of the same. Right now, the hardest hit parts in the United States are the Southwest, particularly the LA area, Southern California, Arizona, and then there's some other scattered states around here, Tennessee, northern Georgia. Here in North Carolina, our epidemiology is shifting a little bit. Our case numbers are still statewide climbing slightly, not incredibly quickly, but climbing. But there are some counties that are actually going down a little bit, including here in Forsyth and to some extent Guilford County. But the counties just south of us and west of us, the numbers are going up and going up faster than what they were in December, or at least in early December. And so if you look at case rates, which is the number of people per 100,000 that are being diagnosed with COVID every day, here in Forsyth County, we're running about 60. And 2 weeks ago, we were right about 80. So we've actually gone down a little bit here. Guilford County is about the same, 60. Charlotte's about the same, 60. But if you get into Yadkin County or Davie County, Catawba, the closer you get to the mountains, the higher those rates go. And some counties are approaching 100. You know, you have to realize there's not, Yadkin County, the population is smaller, so, a few handfuls of cases actually increases that case rate because it's a fraction. But it's real. So for us in healthcare, here in Forsyth County and Guilford County, we provide hospitalization care and acute care services for a lot of the counties around us. And so when you get out towards the west and you look at the hospitals in places like Statesville and Hickory, they're smaller hospitals, so their capacity gets pushed earlier, particularly ICU capacity. And so ICU care is getting a bit tight. So far, we've been able to take care of everyone. We haven't had to pull out, doing people in the gift shop or places like that. It's still exactly the same as what you'd get otherwise. But a lot of planning has to go into it and a lot of coordination regionally and between different health systems. And people need to know that's happening and that, we're all getting together and working to provide COVID care for our region. And I'm really proud of our healthcare systems and our hospitals in the area. They're stepping up and doing what they need to do. And while it's busy, it's safe, and people are getting what they need. So people need to know that. Where are we going to go in the next few weeks with the number of cases of COVID? Likely up. January and early February are our busiest times of year for respiratory viruses anyway. It gets colder, more people stay indoors for their activities. I'm a little bit discouraged that social activities are still occurring a lot. And they're not large, huge gatherings of people or super spreader events now, but it's people getting together with family and friends, and then the whoops, what was I thinking moment about 3 or 4 days later when they get the phone call that someone tested positive and now everyone's in quarantine. If you do get exposed and you have been either placed formally by a health department in quarantine, or you were exposed and are going to quarantine yourself, you have two options. You could either do 14 days or 10 days. Some of that depends on how strong your exposures were, but you do need to quarantine still. I get asked a lot now about, well, what if I was vaccinated? Because as more people get vaccinated, people want to know, well, does that change? Do I still need to quarantine? Right now, yes. If you've been vaccinated, you do need to quarantine still if you've been exposed to COVID. If you've had COVID in the past, if it was more than 3 months ago, you need to quarantine. But if it's been within the last 3 months, you don't have to. That might get extended from 3 months to 6 months because we're finding that immunity from having COVID, for the most part, lasts at least 6 months. Yeah. And in 3 more months, maybe it'll go out to 9 months. Obviously, you only know how much immunity you have after having COVID, once you've gone through that time frame. So, but right now, it's still, if you've had COVID within the last 3 months, you don't have to quarantine. If you've had COVID, should you get vaccinated? Yes, getting boosted by a vaccine can only help, and you get even more immunity. You should wait, maybe a week or so after having COVID until all the symptoms totally disappear, if you're going to get vaccinated. But yes, you still should. I was going to talk a little bit about the new variant because there's still quite a bit of up in the airness about this. So what is the new variant we're worried about? Technically, it's called B.1.1.7, which is what we've labeled it as. And this is the variant that popped up in England probably sometime, maybe 4 to 6 months ago, actually, initially. And this variant is more south and just east of London, and it's sort of taken over as the main viral clade in those areas, and because of that, it's been postulated that its transmissibility is higher. And it makes sense. If a virus is more transmissible, then it might have more of an advantage to take over in a population compared to the other clades of the virus. It's kind of like, I'm having trouble explaining it. But a virus that has more fitness is going to take over more of the proportion of the population where you find that in. And we see that with other viruses, we've seen that with, in fact, almost all of the respiratory viruses we see that with. We see it with flu when it changes somewhat. So people are worried, though, that that it's a mutant, and it seems scary. But all viruses do this. All viruses have small changes in their genetic makeup. That change them a little bit as time goes on. It's just that, like people, as you get older, you change a little bit. And the virus does that too. Actually, in the scheme of things, the COVID virus that's circulating actually is less prone to having these small mutations occur than other viruses, and has actually been fairly stable over the last 9 months. But still, this one's popped up. How much more transmissible is it really? Well, it's going to be a while before we know that. There's only been one study that's been written and published that's examined this. This came out of London and out of England. And it's in the pre-peer-reviewed literature, which means other scientists haven't had a chance to look at it and criticize it and improve it. So it says that the transmission factor is somewhere between 1.4 and 1.7 for this virus, which is higher than 1, which means that it will continue to propagate. And it means about 1.5 people are infected for every 1 person who has the virus. So obviously with time the number will increase. Now at the very beginning of COVID, the virus, we were measuring somewhere between 2.3 and 2.5, which is a higher transmission factor. But if you remember, in those days we weren't masking and distancing was harder. People were still getting together to some extent. So a 1.4 and between 1.4 and 1.7 in a condition where people are taking safety measures is a little bit concerning. But the big question yet is during the time frame that this was occurring in England, how really strict were the people following their safety measures? So you have to add the two together. Is this variant in the United States? Yeah, it is. I mean, I think we found 50-some cases now. We're going to find a lot more as we look for it harder. But it still seems to be an unusual event here in the U.S. and has certainly not been responsible for the wave that's been occurring since Thanksgiving time frame in any of the parts of the United States. So the waves that we're having is just the good old, same old standard wild type COVID virus that started out with. So what should we do about this new variant if it starts to come around? Well, it's going to be the same things. You're going to wear a mask, you're going to personally distance, you're going to avoid gatherings of people, try to avoid bubble fusions between different social groups. And we're going to need to be a little bit stricter about that. And as time goes on, we'll see. We have a little bit of an advantage here in the U.S. because as this variant starts to increase in its numbers here in the U.S., which it will, we're going to be getting more into warmer weather in springtime. People will be outdoors more, and the virus will have a little bit harder time then anyway. So we'll also be getting people vaccinated as time goes on. And as we talked about, the more people who get vaccinated, the more difficulty the virus will have to transmit. If this variant does take over in the U.S., and if it really is that much more transmissible, which is still a little bit up in the air, then it just means we're going to have to get a little bit more people vaccinated and immune to slow the virus down. But it's doable. And so people ask me, do I lose a lot of sleep over it? It's like, no, it's worth watching. It's worth looking for. I do really want to know how much more transmissible it really is. I'm not sure it's quite as bad as what some people in England are saying. But no, I'm not losing any sleep over it because what we're doing to stop it is going to be the same anyway. And it doesn't appear to be more virulent. It's not more mean, doesn't cause more severe disease, and the vaccine covers it. So I think we're okay. So let's talk a little bit about vaccines. So the vaccine, just to put this in perspective, came out, what was it, mid-December, some time frame, is when we got our emergency use authorizations, which means those of us who are vaccine providers, we got the lowdown from the FDA on how to give the vaccine and how exactly to do it and what all the data was. So that was just mid-December, so it's not even been a month yet. It's not been that long. So vaccines are getting into people. Now, if you're watching and you're not a healthcare worker, you're probably wondering where the heck and who is getting vaccinated. But here in Forsyth County, we've had, I don't know, probably upwards of 20,000 people vaccinated so far. And so this has been the people in 1A, which are healthcare workers, and nursing homes, and people who work in nursing homes. I'm a little bit disappointed that a lot of nursing home employees here in North Carolina, only half have said they'll get the vaccine or have gotten the vaccine. And in order to protect our elderly people in nursing homes, we're going to need that number to go up because it's the staff, it's the people working there who bring COVID into the nursing home for the most part. And so in order to really perform, to build that protective cocoon around our vulnerable elderly people, we need our staff to get vaccinated. And I would appeal to them to do so because, you know, the vaccine's safe, it works, it doesn't change your DNA, it's not a live virus. The adverse effects which are expected are a little bit soreness in the arm like I got. Hasn't changed my tennis backhand at all. So I really encourage people, particularly people who are in and around vulnerable people, to get vaccinated when your time comes up. And right now, for the nursing homes, your time is here. You can get it, and I encourage you to do so. Some counties are further along in getting their people vaccinated, and you might ask, so, why is it that Yadkin County or Davidson or something is further along and already really vaccinating their elderly people? It's because they don't have as many healthcare workers in those counties. If you look at Forsyth County, we got a lot of people working healthcare here. And so we got a lot of people to get shots in arms in the healthcare sector. The elderly are starting to get vaccinated, though, here in Forsyth County. In fact, I think the county health department yesterday vaccinated a fair number. I know that Novant system's starting. We here with Wake Forest Baptist Health will be starting. But people are going to have to be a little bit patient. For instance, if you try to call the health department to get an appointment, it's hard to get through. We know that. Would we like it to be faster and better? Yes. There is nobody who wants to get needles in arms as much as me. And let me tell you, because it's our way out of this. But yeah, it's going to be a little bit hard at first. Supplies of the vaccine are limited. So even if we tripled the number of appointments, for instance, at the health department, you'll run out of vaccine. So right now, the number of doses of vaccine we get from the state is pretty much equaling the numbers we're giving out. Same thing for the health systems and the hospitals. We have to pace ourselves for this. The other thing I want people to know is that this is a lot different than like going to get a flu shot. And for some time, you're not going to be able to just get it from your doctor at your doctor's office. The logistics of this vaccine are just too difficult to do that. Having to keep it in a -80 freezer, having to thaw it within a certain period of time before giving it. Once the vaccine is thawed and the vial is opened for the 6 doses in the vial, you have an hour to give that. Once the vaccine is thawed, you can't move it between offices and between geographic areas, and it has to be used roughly up within 6 hours. It depends a little bit which vaccine you're talking about, but it makes the logistics hard. The other thing is there's a lot of informatics that have to go with it. The state requires a lot of information, both for registration to get the vaccine and also after the vaccine's been given, be uploaded to them. And a lot of doctors' offices just don't have that ability to do that yet. So that means that vaccination is going to be done in areas that are collective in vaccination centers. So for instance, the health department might have 1 or 2 centers. A health system in one city might just have 1, 2, or 3 places. And so that means that it's a little bit more cumbersome. It takes a lot of people. For every vaccination site takes at least 1 or 2 pharmacists, 5 to 10 vaccinators, several people to upload information. It takes nurses. People have to sit for 15 minutes afterwards and then looked after to make sure they're not having an adverse reaction. So it's a pretty labor-intensive thing. And yes, I know it's frustrating. Should we have had the rollout faster? I agree with Tony Fauci. Yes, I think we should have. But having looked at it all in retrospect, I kind of understand why we're having a sputtering start here in the U.S. But I want people to know that as time goes on, it's going to get better. And it's going to get better, exponentially better, as time goes on, as all of these logistic things get sorted out. And most importantly, the vaccine that we get out of the state gets to be in numbers so that we can start to vaccinate more people efficiently. The most important thing about vaccinating is to do it in a coordinated, safe way that takes care of the vaccine so it's effective, and it takes care of you as you're going through the vaccination process. So that's the most important thing, and we're doing that. So be patient. Calling your doctor or calling to find out right now is probably not going to be all that helpful for you. It just means that we have to answer the phone more and can't do what we need to do to take care of our patients and to get the vaccine process going. So for people in your health system, check with your, for instance, for us, your My Awake Health account, and there'll be information in there that'll let you know where we're sitting with the phase and how to make appointments and when that might be available to you. Same for other health systems. Most people have an informational account associated with your health record. And that's probably the best way to get in. You can also check websites such as My Wake Health, or www.wakehealth.edu, coronavirus vaccine as one example, and there'll be information on there yet. Here in our health system, we hope to have an 800 number set up probably by next week, so you can call the 800 number and get information. And I know other health systems are doing the same. So county health departments are just as busy, some of them busier than others, for giving vaccines. But I want people to know that vaccines are getting into arms, and the 75 and older are starting now, and it's happening. And that'll ramp up over the next 2 to 3 weeks. And then we'll move on to the next group, which is phase 1B, group 2, which will be the critical workers, including teachers, grocery store people, frontline people who are serving our communities and our citizens. So when will that happen? Probably around the end of the month, I'm guessing. We'll see as we get there. So that's a little bit about vaccine. How's the vaccine safety look? So far so good. I am very encouraged. We have a few people who come in anxious when they get their vaccine, and they might feel a little woozy afterwards. It's normal. You sit for 15 minutes, get a drink of water, and you're fine. That happens in my shot clinic that I do also. It's no different for COVID. And then as far as the allergic responses to COVID vaccine, if you remember, right before Christmas, we were talking about the couple in England and the couple in Alaska. So out of 2.2 million doses given now, we've had 28 anaphylactic allergic responses. So 28 out of 2 million. If you like those odds, go get a lottery ticket. So it's pretty rare. The flu vaccine's allergic responses for anaphylaxis is about 1.5 per million. This one, if you do the math, would be around 10 per million. So yeah, there is a little bit more risk for an allergic response to this vaccine compared to flu, but it's still extremely rare. We've had none in our health system that I'm aware of. We haven't had to use any epinephrine, which is the antidote for that allergic response. And by the way, the epi works, so it's a reversible response. So while we look for it, we're ready in case it happens. There's a little bit of research, well, quite a bit of research actually going on right now on what may be causing that allergic response. It's not actually the messenger RNA component in the vaccine, but the leading contender right now is something called polyethylene glycol, which you may want to just call PEG, P-E-G, which is actually a common component in foods and cosmetics, and can cause rarely allergic reactions, and is responsible for some food allergies. So if you have had a history of anaphylaxis to food, bees, so on, let your healthcare provider know. That's not a contraindication to the vaccine. We just have you wait for 30 minutes afterwards instead of 15. But if you've had an allergic reaction that's anaphylaxis after getting a vaccine in the past, that would be a reason to not get this vaccine, and that's very unusual. Anaphylaxis is when you have trouble breathing, your blood pressure goes down, you need epinephrine. It's not the simple allergies that most people have or think they have. So lastly, looks like here in our area, schools are going to start going through their phased opening next week. So, which I think is totally appropriate. As long as the safety measures are done, and I think it'll go well for them. So, so that's a good sign for going into the new year. So we got another month and a half, maybe two, to slog through with the increased case numbers. I still think as we get into March and into spring, things are going to start to look better. So hang in there. We're getting close to having it get better rather than getting worse. So with that, are there any questions? I see Eric taking notes over there. You got any questions, Eric?
Yeah, there was one, but I forgot about it.
Okay. All right. So if people want, let's go ahead and submit questions again for next week that we can approach. I'm looking over at Joe and group to help with that, particularly about vaccination, because there's a lot of little fine points and frequently asked questions. And if you go, there's a lot out there in the frequently asked questions portions of the websites, either here at wakehealth.edu or with your health system or physicians. Oh, Eric's got his finger up now.
Yeah. I think it might have been last week, maybe the beginning of this week, they come out and said North Carolina ranks like 3 or 4 and the worst to get the vaccine out. What's causing that?
Yeah, so the question is why is North Carolina struggling more than other states in getting the vaccine out? There's a lot of little things that kind of added up to that, I'm not sure it's worth getting into all those, but some of it's we have to register as providers for the vaccine, and that registration process is a little arduous, but is getting better. And then the informatics system that we have to use to upload vaccine and have people register to get the vaccine is pretty new. And if you've ever put a brand new program or operating system on your computer, you know it takes a little while to get the bugs out of it. And so that's getting better also. So it's been a little bit slower in North Carolina than other places, but I can tell you everyone's been struggling. It's just how much you are struggling. But it's going to get better, and I think that in a month or so you're going to find a lot easier to find your vaccine, and your priority group will end up meeting your profile and when you'll be able to get one. All right, see you next week. Submit your questions.